Aspirin reduces the blood's ability to clot.
Perfect, exactly. So specifically, what component, what part of the blood is being affected by the aspirin?
Platelet.
Cells.
Platelets, exactly. So aspirin is an anticoagulant. So anticoagulant, again, in case you guys forgot, anticoagulant means anti-sticky. So it takes away the stickiness from the platelets. And that's how it helps, because if there's some kind of rupture inside the vessel of the coronary artery, what do platelets do? What is the job of a platelet in the body, in the bloodstream? Anybody can answer this question.
It carries stuff, right? Or
Well,
oxygen or something?
No, so the red blood cell carries oxygen. The platelet, what it does, it helps in the recovery process. So if you get a cut, a scab is formed by platelets. So platelets, they play a big part in a scab. So they make a scab and kind of, they patch up any injuries inside the body. That's pretty much what they do. So if you have some kind of rupture inside the coronary artery, now remember, a coronary artery is a vessel that supplies the heart itself with blood. So if you have a rupture inside one of those vessels, the platelets are going to try to patch that rupture up, even if it's not like a really bad rupture, even if it's just like a fat, like a layer of fat is rupturing or kind of coming apart from the inside of the vessel. The platelets will see that as an injury, and it will start to clot, and it will start to form a little mass. And if those platelets keep on bunching up on each other, eventually it can completely obstruct the vessel. So if it completely obstructs the vessel, what's gonna happen to a certain part of the heart? What do you guys, anybody? What's gonna happen if there's an obstruction in the coronary artery?
No blood flow.
No blood.
The blood's not flowing out.
Exactly. So blood flow is not going to get to a certain part of the body, right? So therefore, see, loosages. All right. So if that happens, then the section of the heart that is no longer receiving blood is also no longer receiving oxygen, because the red blood cells carry that oxygen, and it starts to die, right? So the aspirin. Hey, can you, whoever has their mic on, please turn it off. Awesome, thank you. So the aspirin, what it does is that it prevents the platelets from bunching up on top of each other. So it's more like a preventative thing. That's why it's taken daily by patients that have cardiac issues. So they have like hypertension and stuff like that. They'll be taking this because they have a higher chance of getting a heart attack. So whenever you have an obstruction, that obstruction we talked about in the coronary artery, whenever that happens, that is by definition a heart attack. Remember, a heart attack is mechanical. That means that blood is not flowing to a part of the heart because the coronary artery is obstructed. Any questions about that?
So aspirin, like generally just speaking, it kind of counteracts the job of what the platelets are doing?
Yes.
Okay.
Yeah, that's exactly what it does. And it helps certain patients by doing that. Because the body, sometimes when it tries to protect you, it does too good of a job to where like it actually is bad, it's harmful for you.
Mm-hmm.
Yeah. Does that make sense though?
Yeah.
Okay, cool.
Yeah.
Awesome. So real quick, see, I'm just gonna pick on somebody. So Juan, so what again, just throw it back at me. Why do we give patients aspirin? Or why are cardiac patients taking aspirin? What's the point behind that? What's going on?
It's for to heal the blood clots for the platelets, right?
To prevent blood clots from forming, right?
Prevent blood clots.
Clotting. To prevent not blood clots, but clotting by the platelets. Okay. So I'll keep moving. Any questions about aspirin or anything like that? No? All right, so there are two different dosages. You guys should look them up. I forgot the exact dosages, but I know it's either 160 something or 300 and something, and it's double. One's just double from the other dosage, like 168 and like 320 something. But look those up, and you have to know those for your NREMT, okay? That's gonna be a question that comes up on aspirin. So, down here, let's see what it says. Aspirin is administered to patients with chest pain of a suspected cardiac origin. You see, David, can you tell me chest pain of a suspected cardiac origin? So that right there, chest pain of a suspected cardiac origin. What do we call that? So what exactly do we call that? There's a name for that. Do you remember?
Like a heart attack?
No. So you'll get chest pain from a heart attack, but does anybody know what that word is? I'm looking for a specific word.
Is it angina?
Yes, exactly. So angina, whenever you hear angina is chest pain, but it's specific to cardiac. So it's chest pain due to a lack of oxygen to a part of your heart. All right. So if you don't know that, I would write down angina and then write this as a definition: chest pain of a suspected cardiac origin. Okay, so you have to know what that is. Every time you hear angina, think chest pain, but it's connected to cardiac. All right? That's the reason for the chest pain. All right, glucose. So most likely, which type of patient will be getting glucose, Michaela?
Someone with low blood sugar,
Low blood sugar.
like diabetic.
Yeah, so your diabetic patients. Now, Luz, what is a symptom that would indicate a patient is low on glucose? Like, what would you suspect a Well, first of all, a patient that is low in glucose, they are what's called hypoglycemic. So hypo meaning low, glycemic talking about sugar. So hypoglycemic means low sugar. So a patient that's hypoglycemic, how would you expect a patient like this to act or to present? That's probably the question. Yeah, that's the question I want to ask you.
They would have an altered mental status.
Perfect. So they would be acting a little loopy, right? They wouldn't be what we call normal. They wouldn't really act normal or respond normally. Good. Any questions about glucose? No? Okay, so let me go back to aspirin real quick. Who can tell me, well, first, actually, what is a contraindication, Jessica? What is that? What's a contraindication?
It's like a reason you shouldn't take a medication.
Exactly. So it's a reason you wouldn't give a drug, even though normally under these circumstances you should give the drug, but there's something preventing you from doing it. So what's one contraindication for aspirin that you can think of? Remember, it slows down clotting, so it slows down scabbing.
I would
Blood
say
thinners.
What's that?
Blood thinners. If you're on blood thinners.
Blood thinners. Yeah. So if they have blood thinners, they probably shouldn't be taking aspirin. But what's another reason? Anybody else?
If they're bleeding.
If they're bleeding. So if your patient was just in a trauma situation, so let's say the guy was driving or the lady was driving, right? They were driving, they had a heart attack as they were driving, and then they got into a car accident after that. So it was trauma secondary to medical, right? So in that case, you definitely do not want to give this patient aspirin because they could already be bleeding internally. And if you give them aspirin, you're only going to speed that up or prevent that from healing properly. So that's why they might bleed out. What's another reason you wouldn't want to give a patient aspirin? How about any recent surgeries, right? So if they had a recent surgery, you might not want to give them aspirin as well. So that's a question you want to ask them. Okay? Cool. Questions about aspirin? No? All right. Trevor, one more time. What kind of patient would be taking aspirin?
I'm sorry, can you say that one more time?
What type of patient would be taking aspirin? We suspect would be taking aspirin.
That would be someone who is having chest pain that's suspected to be of cardiac origin.
Okay, I'll take that. That's good. Glucose, I think I hit that up enough. So glucose in the body, it's responsible for producing what in your body to keep you alive? Anybody?
ATP.
ATP. And what else is needed along with glucose to make ATP? A good amount of ATP.
Oxygen.
Oxygen. Awesome. So oxygen and glucose make ATP. What kind of metabolism is that? Is that aerobic metabolism or anaerobic metabolism?
It's aerobic.
Aerobic metabolism, yes. So if you don't know that yet, just guess how to write aerobic metabolism. And that just means that we're making ATP with both glucose and oxygen. Anaerobic metabolism, so ana meaning without, anaerobic metabolism means you're making ATP without oxygen. There's no oxygen present, just glucose. And this is nasal cannula. Let's see if anybody remembers this. So who can tell me the liters per minute for a nasal cannula? Between what and what? What's the range?
0 and 6.
Okay, yeah, 0 and 6. I'll take it. Yeah, most likely on your test and any textbook, you'll see it as 2 to 6, but 0 and 6 is of course acceptable, I guess. So yeah, 2
Sorry,
and 6.
what was that question?
So for your nasal cannula, what is the liters per minute that you give oxygen to your patient? And it's 2 to 6 is, I guess, the correct way on your textbook and for your test. But you know, 0 to 6 liters per minute, that's also acceptable. I'll take that.
Okay.
Okay. All right. So activated charcoal. Is this activated charcoal? Yeah, activated charcoal. Let's see, Veronica, who would you give activated charcoal to? Which kind of patient?
A patient suffering from poisoning or overdose.
Yes, poisoning, exactly. Now, these patients, most likely, if it's like a overdose of medication, that you will be giving charcoal. And does anybody know or have an idea how activated charcoal actually works in the body?
It bonds to the chemical and absorbs it, so your body doesn't absorb so much.
Perfect. Yes, it does that. That's what it does. So once you eat that charcoal, the charcoal has so many crevices. Like crevices is a fancy word for like cracks, right? A lot of crevices, really small crevices and cracks. And it actually absorbs the medication in the stomach. So like you just said, the patient will actually poop that out as opposed to it going into your system. Now, what's a window to give this medication as far as time goes? Let me see. Seth, just give it a shot. When do you think is a good time frame to give this medication, or after how long would you maybe not want to give this medication because it's not going to be as effective?
I think like pretty rapid, like after they take it, as soon as you get on scene, probably 15 minutes after.
Yeah,
it's after. I mean, after
minutes,
a while.
It's a good time frame to give it, but pretty much you want to give it within 1 hour of them taking the whatever they overdosed on. So if you don't know that, write that down right now. You want to give activated charcoal within 1 hour of the patient taking it, because after 1 hour, the body most likely will have absorbed it. Okay. All right. What's up? Go ahead.
Is there anything that we can do after that hour?
No, after the hour is just like it's like internal bleeding. You got to go fast and just take them to the hospital, depending on the situation. The situational, obviously, but no, you have to get them to ER to maybe pump their stomach or dilute it with some IV fluids. If you're with a paramedic, obviously the IV fluids will dilute the poison in the body. Might help with that. But as far as the BLS level, there's not much we can do at the BLS level.
Okay, gotcha.
Yeah. And what's a contraindication for this? When would you not want to give activated charcoal? I'll give you a hint. It's the same contraindication for glucose. For
them being unconscious.
Yeah, so the inability for a patient to swallow. So if the patient cannot swallow, and or if they are mentally altered, those are really the only contraindications at the BLS level. Okay, the BLS level for activated charcoal and for glucose. Questions?
Yeah. What happens if they've overdosed, or because if you give them the charcoal and they've overdosed, you're trying to help them, but they're technically in an altered state or unconscious. What do you do then?
Well, then you wouldn't give it to them. See, this is for patients who have maybe just taking the drug the other students said, like they taking like within 15, 20 minutes, they're in that like oh no moment to where like they can't believe what they just did type of thing. They're still conscious, but the drugs haven't really kicked in that well. So obviously your patient would have to be conscious for this.
Okay.
Anything else, just take them to the ER and they'll take care of the patient there. Again, at the ALS level, the paramedics, they can do more stuff like, dilute it with some fluids and stuff like that. But yeah, that's pretty much it. All right.
Since we're on the topic, someone who's poisoned, you don't want to induce vomiting, correct?
You do not want, they used to give this thing called Epicac, and they used to make patients throw up, but you do not want to. Who can give me a guess as to why you would not want to induce vomiting, or why that would be maybe contraindicated? Just one
Risk of
scenario.
aspirations.
Exactly. Aspirations is a big one. So that's the big one. Also, the other one is sometimes patients they'll swallow acids to poison themselves. And if it's an acidic, that's gonna burn on the way down, and it's also gonna burn on the way up, so you cause more damage also. And on top of that, you have the aspiration factor. So those two are the biggest factors why we do not want to induce vomit. Okay? Those two reasons. Okay, bronchodilator. So I mean, the name's right there. What does it do? Let me see. Probably not. I don't think Andrew. What does a bronchodilator do? What's its purpose?
It dilates the bronchioles in the lungs, so someone can get more adequate amounts of air in their lungs.
Yes, exactly. It's a bronchodilator. It dilates the tiny tubes. Remember, you have your trachea. So the lower airway starts at the trachea. Then you have your main bronchi, the two bronchi that split off from the trachea. After that, you have your tiny little branches that are the bronchi. And in the bronchi, the little smooth muscles inside the bronchi, when they spasm, pretty much they're like spasming, constricting, that prevents adequate amount of air to come into your system. So the bronchodilator, the inhaler, will reverse that. It will dilate the bronchioles to allow more air to come in. Easy as that. It pretty much relaxes the muscles inside the bronchi, or bronchioles. I'm sorry, the bronchioles. So, which patient would most likely have a bronchodilator or inhaler? What would this patient have as far as a medical issue, condition? Asthma. Perfect. Yeah, asthma's the big one. All right, so we talked about the inhaler, epinephrine, nitroglycerin. Let me see if they actually, okay, so we have, okay, so I'm gonna go into them when we get to the actual PowerPoint. Any questions so far about anything? I know some of you guys might not have been in class yesterday, so if you guys have any questions, by all means, go ahead and ask right now before I continue on. No questions about anything in general? All right, cool. Let me get back to it then. Where is it at? All right. See, so bronchodilator, we talked about this. So not just patients with asthma, so patients that have emphysema and also chronic bronchitis, they will also or may also have a inhaler. Now, let me see if one of you guys remembers this. So Trevor, if your patient has emphysema and chronic bronchitis, both of those combined, what is that disease called? Or what is that called when you combine both of them?
I don't remember, sir.
Okay. Does anybody remember what that would be called?
COPD.
COPD, chronic obstructive pulmonary disease. So whenever you hear those words, COPD or chronic obstructive pulmonary disease, that is really two diseases or more combined together, and that is what that is. It's chronic COPD. So if your patient has emphysema and chronic bronchitis, they have COPD. And also, if they have asthma, they just kind of throw it all together, and that's COPD right there. See, bronchodilator enlarges constricted breathing tubes, we talked about that. That's the bronchioles. So side effects, increased heart rate and patient jitteriness. All right. Questions about this? About the bronchodilator? Nope. All right. So let's just review real quick. Jessica, which kind of patient gets a inhaler?
An asthmatic patient.
Asthmatic patient. Michaela, what does it do for your patient?
It dilates the bronchioles.
Perfect. And Seth, is albuterol or inhaler, is that a medication that you would have with you on the ambulance, or is that something that would be prescribed to your patient?
That's prescribed.
Perfect. Awesome. So nitroglycerin, this is also a prescribed medication. Your patient will have this on their body when you come up to them. Again, taken by patients with history of chest pain of cardiac origin. So chest pain of cardiac origin. Andrew, what did we say that was called again?
Can you repeat that one more time, please?
Chest pain of cardiac origin. What is the name for that? There's a name for that.
Oh, angina.
Angina, perfect, yes. All right, so that angina, the chest pain, where exactly is that coming from, Trevor?
Would that just be coming from like the heart?
Yeah, so the angina, which is chest pain of cardiac origin, is coming from the heart. So every time that there is a lack of oxygen to any part of your body, the pain right there is a signal to you saying that that's your heart pretty much saying, hey, I need oxygen, help me. So every time you have angina, chest pain, it's your heart pretty much like screaming out for help. That's what it does. So the nitroglycerin helps by dilating the coronary vessels. Who can remember the example I gave when talking about nitroglycerin, like as far as how it helps in the body? Does anyone remember that example I gave, or somewhat of that? No? Let's see. Somebody's gonna call somebody, see if you can lose. How does nitroglycerin help in the body? What happens with nitroglycerin? You there, Luz?
Yeah. It helps get blood through the vessels faster.
It does. That's exactly. It helps get blood through the vessel properly. So how does it do that though? What does it typically do?
It dilates the vessels, allowing blood to go by easier.
Yes. So if there's an obstruction, good job. Thank you, Luz. So if there's an obstruction in one of your coronary arteries, and I might flip. Let's see. Just give me a second. I'm gonna draw it up here and then show you guys on a little board I got. All right. See him stop sharing for a little bit. You guys see me?
Yes.
Yeah.
All right. So we'll say that this right here is a heart, right? And then your aorta comes up from the top. Your aorta is the vessel that takes blood, carries blood to the rest of your body to feed it with oxygen and nutrients. Well, right after that aorta leaves the heart, as soon as it leaves, these arteries branch off from the aorta onto the top of the heart itself, right? So you have your coronary arteries that feed the heart itself. Now, I'm gonna take this artery right here and blow it up. So we'll say this right here is this vessel. That's one of the coronary arteries. If for some reason you have a clot, something gets stuck somewhere along this vessel, we'll say it's stuck right here. that clot most likely is not gonna grow. It's gonna stay the exact same size. It just got stuck there because that vessel wasn't large enough in diameter to allow that to fit through it. That's the only reason it got stuck, right? So if you give your patient nitroglycerin, what it's gonna do is it's a vasodilator, so it's gonna dilate. It's gonna make the vessel bigger. So when that vessel gets bigger, this obstruction, this little clot or embolism, this embolism is gonna stay the exact same size. So now the vessel got bigger, the vessel grows, and either depending on what the issue is, that obstruction is gonna stay the exact same size. Can you guys see that or no?
Yeah.
All right. That obstruction is gonna stay the exact same size, and it's either gonna be stuck on here on the wall, and then blood is going to flow around it, or it's just going to continue on down that vessel and maybe get stuck somewhere else, but at least you allowed blood to the section of the heart and you gave them more time until you get to the hospital. And that's what it comes down to. Any questions about that? Or do you want me to explain it in a different way? Because I want to make sure you guys get this. Nitroglycerin is super important because cardiac is a big issue.
That makes perfect sense.
Good, awesome. All right, so I'm gonna go back to sharing and share screen. All right. Okay, so taken by patients with history of chest pain, we talked about that. It helps dilate the coronary vessels. We talked about that. Now, if it's a vasodilator, right? So if it's a vasodilator, that means that the pressure inside your vessels is gonna go down or up if the container gets bigger, but the fluid remains the same.
Down.
It's gonna go down, right? It's a vasodilator. So as that container gets bigger, being the container being that vessel, the fluid being the blood, the level is gonna go down because the container got bigger. If the fluid level goes down, the pressure goes down as well. So with that being said, you do not want to give your patient nitroglycerin if they are hypotensive. Remember, hypo means low. Tensive, we're talking about the pressure within your vessels. Because if your blood pressure goes down too low, then that means that the blood is not going to go fast enough to deliver that blood on time, that's going to deliver the oxygen to the tissues of the body. Okay, so that's a big problem. So if your patient has hypotensive, meaning they have a low blood pressure, they are not to take this drug because you can kill your patient. So generally, if your patient's blood pressure is the systolic, if the systolic blood pressure, meaning that the top number, if that is below 90 to 100, you will not be giving this patient nitroglycerin. If you do not know that, or if you forgot that from the class, write that down right now. If your patient has a low blood pressure, which is between 90 to 100 systolic, they are not gonna be taking this drug because their blood pressure will drop too much, maybe. So on top of that, why would you also not want to give your patient nitroglycerin if they take in any one of these drugs right here? Viagra, Levitra, Cialis. Let me see, Drake. Why would you not want to give your patient nitroglycerin if they have taken any one of these drugs right here that are on the screen?
Because those drugs do the same thing. They dilate vessels.
Perfect. And you don't want to stack vasodilators on top of each other because the patient could crash. And then Veronica, do you remember what is the max amount of dosages you're gonna give this patient?
I do not.
Anybody remember that?
No more than 3?
No more than 3. And let's say you gave your patient one dosage, right? It's the very first dosage they ever had, of nitroglycerin. It's the first time they have chest pain, but they have it prescribed because they have symptoms that allow them to have that prescribed to them. You go to the patient, they've never taken nitroglycerin, you give them nitroglycerin. How long do you wait before you give the next dosage of nitroglycerin?
15 minutes.
Is it like 3 or 5?
5 minutes.
5.
5 minutes. And the reason you wait 5 minutes is because nitroglycerin, it takes up to 5 minutes for it to act. If it doesn't, if the patient is not relieved of pain or discomfort within 5 minutes, you can give them another one if their blood pressure isn't low. Okay, so before you give them the other dose, make sure that their blood pressure is not below what? Anybody? Just say it.
90 to 100.
90 to 100, systolic, perfect. You see, so we don't give it if they have low blood pressure. We don't give it if they're taking any erectile dysfunction medication. We don't give it more than 3 times. Blood pressure has to be rechecked. I feel like I'm missing something with you guys here. If it comes back to me, I'll mention it. But I think that's pretty much it. No, I'm missing something. Yeah. What am I not talking about? Contraindications, low blood pressure. Okay. If you have given your patient nitroglycerin 3 times, but their blood pressure is 140 over, let's say, 80, right? They still have that chest pain. It's super painful. It doesn't go anywhere. It's 9 out of 10. It's horrible. And the patient would like to get one more dose of nitroglycerin, and you think that it might be okay to give this patient nitroglycerin. What do you do before you even give this patient nitroglycerin?
Would be contact medical control or medical direction?
Yes. And what kind of medical direction is that? Is that online or offline medical direction?
It's online.
Online, perfect. Yes. All right. I think that was it. This is epinephrine. Who can tell me what epinephrine is used for? Which kind of patient would be taking this?
Allergic.
Yes. Any patient that has a severe allergic reaction. Oh, also before I forget, nitroglycerin. You have to know the dosages. So I believe it's a 0.4 grams or 0.04 milligrams or something like that. But look it up, right? You have to know the dosages, and also know that it is sublingual. So sublingual means that it goes under the tongue, okay? Under the tongue. Epinephrine. So let me see. Melanie, how do you give epinephrine? Do you remember? How does it give it to the patient?
Through an EpiPen, right?
Mm-hmm. Yeah. Where on the body would you put the EpiPen?
Like a muscle, a thigh, a arm.
Yeah. Usually the best place would be the thigh, on the side, the lateral side of the thigh, and you just puncture or push down hard, and you hold for 10 seconds. Okay. And let's see, epinephrine. Is this going to be prescribed to your patient, or is this going to be on your rig? Anybody?
It's going to be prescribed to the patient.
Prescribed. Perfect. They prescribed and used for patients with severe allergic reaction, classified as anaphylaxis. So if you don't know this yet, please write this down. Severe allergic reaction equals anaphylaxis. So they're interchangeable. Vasoconstrictor, and so during anaphylaxis or a severe allergic reaction, usually 2 things happen. All right. One is your vessels dilate. So that means your blood pressure goes down, right? If your blood pressure goes down bad enough, you're gonna crash. Your patient's gonna go into shock. So that's one thing. It's your vessels are going to dilate. The other thing is that your bronchioles are going to constrict. So now not only is your blood pressure going down very dangerously, but now at the same time, you're not really having an adequate amount of oxygen coming into your system to even supply the tissues. All right, so those 2 are really bad. And what epinephrine does, it just completely reverses that. It constricts it's a vasoconstrictor, like it says here, so it's a vasoconstrictor. And it's a bronchodilator. So it's gonna open up the bronchioles and allow air to come in, and it's going to bring that pressure up in the body by constricting the vessels and making that container smaller, which allows the fluid to run faster to deliver that oxygen to the body. And so a side effect, increased heart rate and blood pressure. Again, that blood pressure is from the vasoconstriction, but it also is from the increased heart rate. I'm not sure if this is a bad side effect. I know a side effect is like something that you weren't expecting or don't really desire. But in this case, I mean, if it increases the blood pressure, but that's a side note. Don't worry about that. But any questions about epinephrine? No? All right.
I have a question.
What's up?
So you said they don't carry them on BLS here?
Yeah, as far as I know, not yet, but I'm pretty sure that's gonna change pretty soon if it hasn't already in some counties because other states do carry them.
So if we're working on ALS, can EMTs give epinephrine?
No,
Okay.
they cannot. No, they cannot. Nah, because the epinephrine that's given by paramedics usually is through like IV push or IV drip or something like that.
Oh, gotcha.
Yeah,
Alright.
so yeah.
And also, where on the thigh did you say that you gave the epinephrine shot?
So it's gonna be lateral. That means on the side of the thigh. So on the
Okay.
side. Yeah.
Inside or outside?
Outside. So lateral is on the outside. Like towards
Okay.
out. Yeah.